Welcome to the live Health Talk broadcast. Today's Saturday, November 21st, and we're talking about bariatric surgery, sometimes known as weight loss surgery, with Dr. Piotr Gorecki. Dr. Gorecki is the medical director of the Bariatric and Metabolic Surgery Center at New York Methodist Hospital. He is the chief of the hospital's division of laparoscopy and an associate professor of clinical surgery at Cornell University's Weill Medical College. He's also a board-certified surgeon with a special expertise in laparoscopic surgery. So if you have a question about what bariatric surgery is, what makes someone a suitable candidate for bariatric surgery or weight loss surgery, you can call us toll-free at 1-800-685-8444. That's 1-800-685-8444. Thank you for joining us this Saturday, Dr. Gorecki.
Thank you for having me. It's a pleasure.
How does someone know if he or she is obese rather than just heavy or overweight?
Well, traditionally, we view individuals certainly by weighing them and calculating their height and see whether their weight is appropriate to their height, and as well as their age and their sex can be put into some of the calculations. Now, the most scientific way of assessing the degree of overweight or obesity is by calculating their so-called body mass index, or shortly BMI. And when your body mass index is between 18 and 25, it means that you are normal or healthy weight. Now, how do you calculate it? You simply put your weight actually in kilograms, and you divide by your height in meters, and you square it. And it gives you that one single number that is really the best way to assess your overall situation in terms of weight. Now, when you get into the body mass index of more than 25, that's when the condition, we call it that you're overweight. So between 25 and 30, we call it overweight. More than 30, we call it obese, with a certain degrees of obesity to the extent that when your body mass index is more than 35, you actually call it severely or morbidly obese. That's the time that your life and your health is at serious risk, and the consequences of your excess weight really impact severely on your health. You can calculate that number again by yourself on a calculator or any websites. You can Google up things. There's tons of body mass index calculators, and this will give you that number and will put you in a chart of your weight situation in terms of your being overweight or severely overweight or obese or normal or very, very rarely actually now underweight.
Okay, if you have a question about bariatric surgery, what it is, what the recovery period is like, if what makes someone a suitable candidate for bariatric surgery, you can call us toll-free at 1-800-685-8444. That's 1-800-685-8444. We're talking with Dr. Gorecki, who is the medical director of Bariatric and Metabolic Surgery, the Metabolic Surgery Center at New York Methodist Hospital. So you are a bariatric surgeon. What does the term bariatric mean, and what is bariatric surgery?
Well, bariatric surgery is sort of a nice description of simply weight reduction surgery. Baros in Greek means weight.
Okay.
So that's simply more of a ancient and elegant way to name our profession. But it really means weight reduction surgery. Now, who would be the candidate for the surgery? At what sort of weights we think about people being candidate for the operation? We really talk about severe obesity, not just slight overweight or 20 or 30 pounds above what you should weight. Roughly, really, it corresponds to about 100 pounds above your ideal body weight. But really the more specific way to determine that would be, again, as I mentioned before, to calculate your body mass index, which should be in a range of 35 in order for you to qualify for the operation.
Okay. What are the risks of bariatric surgery versus the risks of staying morbidly obese?
Yeah. Well, that's a very good question, because it really comes down to philosophy in medicine in general, why we do certain things, because virtually all interventions in medicine, including pills, including the most simple things such as aspirin or any antibiotics, can carry significant side effects which can be even life-threatening. Now, we do take it because those adverse effects do happen very rarely, and there are certain benefits that markedly outweigh the risk of doing this. The same concept really holds true for the obesity surgery. We do it because, number one, there's no alternative to successful treatment of morbid obesity. In other words, just by dieting and exercising and telling people to eat less, exercise more, and join the club, the success rate with that sort of approach is virtually zero. Now, there are certain medications that you may take. There's really very few approved by the FDA, and all the clinical trials show very, very modest improvements in your weight on a long term. And these medications tend to also have a certain side effects, and they are rather costly. They are insurance companies rather have a trouble approving their usage, partially because of the reason that they are not that effective. So finally, the really what is left is the operation. And unfortunately, there's nothing much between operation and doing nothing in terms of honest, successful outcome. So that's why we do the operation. And the surgery has been shown to be, at this point, the only modality that can provide morbidly obese people with significant and sustained weight loss. Weight loss that averages about 50 to 80% of your excess weight. Weight loss that translates to you living longer and happier life. Weight loss that cures or gets better a lot of the medical problems that are associated with obesity, such as diabetes, the type 2 diabetes, the high blood pressure, the sleep apnea, the joint pain, arthritis, but also many others, such as infertility, menstrual problems, certain cancers, and virtually all medical conditions can get worsened by the fact that somebody is obese and even overweight.
We have a caller. Maureen, you have a question for Dr. Gorecki?
Yes, actually there are two. One
Hello, Maureen.
is, hi, how are you?
Good, thanks.
This is such a great, fortuitous, I turned on this program. I'm very happy that this is being aired. Doctor, in the morbidly obese person, is it preferential to have stomach stapling or gastric bypass as opposed to lap band surgery? I understand lap band surgery has a slower rate of weight loss, and therefore you don't have all the hanging skin and that sort of thing. Can you answer that, please?
Sure, that's a very good question. And indeed, there are some options when we evaluate patients, and first we determine whether somebody can be a candidate for surgery. And at this point, we really do not make any differences in terms of that somebody might be a good candidate for bypass or only for the lap band based on the really weight or any of the specific habits, because the attempt to provide such a, let's call it profiling in good terms, individuals who might be the best candidate for what operation really did not show to be of any significant success. So what we do is first we evaluate the patient. We take all the history and we do the physical examination. And if somebody is in the age of between 18 and 65 years old or so, and does have body mass index more than 35 with certain medical conditions, or more than 40 without even any medical conditions, at this point, just the degree of obesity is so severely affecting people's life that just by the virtue of them being so heavy, they suffer from so-called morbidly obese, which means that they will become candidate for surgery. Then the next step is really to talk to them about surgical options. And We do that at the time of the consultation. We explain, we actually show the graphs, and we show the real lab band system to people to touch and even play with this if they wish. And we give them brochures that we have for gastric bypass, for the lab band, and finally we do have monthly education seminars and support groups that for more than an hour I give the talk presentation explaining the differences. But to answer it shortly, gastric bypass is a little bigger operation. It really reroutes the way the intestines are shaped and connected to the stomach. We really make your stomach of a size of a golf ball or ping pong ball, and then we connect it directly to the small intestine, bypassing the, let's say, 95-98% of your stomach. And this really provides people with, first of all, satiety. They're not that hungry. Number two is they can consume only smaller volume of food because you simply feel full much quicker than from your times before surgery. And finally, if you really try to overeat, you may have some unpleasant side effects, such as some discomforts and even vomiting. Now, with the lab band operation, all we really do is we put this piece of silicone ring around the very first portion of the stomach, right below the esophagus. And by doing that, we induced satiety so that the people, again, are waking up and they're not that hungry, looking for food. Rather, they try to focus on the other activities. And in a very similar way, they are actually consuming less food because they feel full much quicker. So even if both operations are having really different principle, one is we do the typical gastrointestinal surgery, cutting and stapling the stomach and intestine. That's the gastric bypass. With a band, we just put a silicone ring around your esophagus, connecting that we can adjust it. Actually, we can adjust that restriction, or that we call it stoma. We can regulate it by putting some fluid in or removing fluid out of the system, making you more or less restricted. So that's really how we approach it. There's not enough data at this point to tell somebody, look, I think that you are a perfect candidate for band or you're a perfect candidate for bypass. We give it as an option. We inform about both operations, and we try to find individual perception, individual thought about it. In general, you're trading a little less complicated, easier, quicker operations such as banding for a little less weight loss, less more of a slower weight loss with potentially less chances of improving or resolving some of your medical problems, primarily such as diabetes, for gastric bypass, which in general is more effective. There's quicker weight loss, there's more pronounced weight loss, but indeed it is a little bit of bigger operation. But fortunately, we can do both of these operations very safely and very efficiently with a short hospital stay. So
you do perform both of those types of surgeries, Dr. Gorecki?
Correct. I think at this point we have no data and no information to choose one operation for everybody. And just because we don't have the better operation, we have both operations which we use as a valid tools depending on patient's preference, some of the personal experience with some of the friends and family that they had operation, and again, a risk tolerance and disability that they can allow themselves. After banding operation, you practically can have it done on Thursday, and if you want to go back to work on Monday, you have a very good chance that you're going to succeed doing that. With a gastric bypass, you should probably count for a few more days home and a little longer recovery.
If you have a question for Dr. Gorecki about weight loss surgery, you can call us toll-free at 1-800-685-8444. That's 1-800-685-8444. And if you'd like to call his office for more information about the different types of bariatric surgery, laparoscopic bariatric surgery, the different support groups that are available for people interested in bariatric surgery or weight loss surgery, you can call 718-780-3292. That's 718-780-3292. He's a board-certified surgeon with a special expertise in laparoscopic surgery and an associate professor of clinical surgery at Cornell University's Weill Medical College. If you have a question about what weight loss surgery is, what the side effects are, who makes a good candidate for it, again, you can call us toll-free, 1-800-685-8444. Before the break, Dr. Gorecki, you were talking about lap band surgery where something is actually put around the stomach.
Correct.
Does that band ever slip or come off?
Well, to answer it shortly, yes. Any operation, as I mentioned, can cause side effect and potential complications, and our job is to minimize those complications and optimize the benefits. Now, the lap band operation initially was developed in this country and then was adopted in really the rest of the world, including South America and Australia, Europe, where these operations were performed several years earlier than in the United States because we simply did not have FDA approval at this time. And the experience as it was growing, we noticed that some of the patients with a lap band had it slipped onto the stomach or eroded into the stomach or esophagus. And initially we tried with quite cautious adopting this technique in the United States. However, after more detailed research and analysis, we have found that many of these complications were related to the technique that were used, that has changed significantly since then. And although those risks still exist, they are quite small, and they should not really be higher than few percent. So let's say if you do have a band operation, the chance that you're going to need some sort of secondary operation to remove it or reverse it or adjust it because of the slip or erosion is really quite small. And in overwhelming majority of the patient, they will go through their life with a band and they will be functioning well.
Okay, so the band stays on for the rest of your life?
Correct. That's one of the questions that frequently people ask. Well, what if I lose 85 pounds? That will be my target, and can we remove the band? And that's really one of the ultimate evidence that it is a obesity, and particularly morbid obesity, is a lifelong incurable disease. And all we can do with a band or with a bypass, we can improve people's symptoms of hunger and make them lose weight and feel better. But if we would ever remove the band, and we see it occasionally in a situation that we do have to remove the band for whatever reason, that people universally regain all their weight back. If they lost 80 pounds, we remove the band, and they're going to be this 80 pounds back within an amazingly short period of time.
Wow. Let's go to a caller. Ed, you have a question for Dr. Gorecki?
Yes, I do. Good morning to both you and Dr. Gorecki. I'm calling for two reasons. Number one, for my dear sister who is 50 years old and definitely morbidly obese, over 40, almost 40 BMI. And she's been at that weight for over 10 years with a series of medical conditions. I have tried to assist her with different kinds of modalities that are not very intrusive or invasive. And of course, my concern, in addition to her, is that her daughter, who's 15 years old, I remember when my sister was 15 years old, and I saw her in the beginning, and she looked very good. And her daughter, 15, is at a point where I would say right now she's almost approaching 25 BMI. So the condition has escalated to a point where it's affecting her daughter as well. So my question is, it is, if we were to do a gastric bypass with my sister, she doesn't seem to realize how severe and dangerous her situation is. It's like she'll try different things for a week or 2 weeks, and then she goes back again. There's no incentive. So my question is really, how do you address during the point of evaluating a candidate for one of these surgery if they are mentally in a state where this will really be worth their while?
Yeah, well, that's a very good question, and really to answer it, the people who are morbidly obese and they have the BMI more than 40, they have some medical conditions, the chance that they're going to lose weight on their own without surgery is very, very minimal, is virtually close to zero. Yeah. So a lot of these people will be quite frustrated because they are 250 pounds, their body mass index is 45, they are diabetic, they go to see their primary physician who tells them to lose weight, and it's not happening. And it's not happening not because they are lazy or they are not intelligent or they have any lack of sufficient knowledge what to eat and how to live their lives, but it is indeed a true lifelong, severe, incurable disease, and they have to take and realize what are the consequences of their condition. And their consequences are that they're likely to live significantly shorter lives. Consequences are that they are at significantly increased risk for worsening their medical problems, including worsening diabetes, worsening high blood pressure. As they old, their joints give up because they have to carry on all this weight, and now they really cannot walk or they cannot exercise, and they more into the sedentary lifestyle because the activity is not an option here, and they further gain weight. So it's a vicious circle here, and I think first thing she has to realize is that she needs help. This is a chronic disease, and we should try to get help when we are sick, because that's really we are going to be sick at some point, and there's no reason just to suffer without getting any help, or at least getting the information, getting certain statistics of what's going to happen to me if I don't do this, and what's going to happen to me if I go for certain treatment. So she definitely needs to see, she needs help, first of all. How she's going to arrange the help, not a bad idea is just pretty much go and see the surgeon who does perform the operations, because, again, we don't have really much options here, and continue seeing nutritionists or joining certain programs or gyms are not going to be here effective, and the surgeon will provide her with initial information and consultation as to what are her options and whether she would qualify for the surgery. And then she can live with this information for quite some time. It's not a cancer. It doesn't really kill people instantly. Mm-hmm. And she can view and slip on that opinions for quite some time, looking for even additional information, such as joining support groups, looking on the internet and a variety of information, and finally, at some point, committing to proposed treatment, which really in 2009 means obesity or weight reduction or bariatric surgery.
Ed, if you want to call the number for the support group at Dr. Gorecki's Institute of Bariatric Surgery, it's 718-780-3292. That's 718-780-3292.
Yes, I have another question, if I may.
All right.
Yeah, the another thing is, suppose we get her to a point after evaluation that she's definitely ready and she's a candidate. We don't have the insurance that covers to be able to pay for this because her insurance will not cover. What other options do we have? Do you have some? If I were to bring her from where she is right now,
well, that's a good question. Dr. Gorecki, does insurance usually cover weight loss surgery these days?
Right. Based on really overwhelming evidence that there's no alternative successful treatment to morbid obesity other than surgery, and surgery is a safe and effective and durable tool to manage this condition, the insurance companies, including government insurance companies, including Medicaid and Medicare, do cover the operation in overwhelming majority of the situation. They do have certain guidelines, and these guidelines certainly will reflect on a degree of obesity. Usually it has to be body mass index more than 35. People have to show certain commitment to the surgery, such as attending so-called medically supervised diet program, usually with their primary physician for several months, often as long as 6 months. And they have to be otherwise willing to do that, knowing the risks and benefits, getting into preparations, certain medical testing, which frequently include endoscopy and echocardiogram, pulmonary function test, in selected patients' sleep study, so that that if those conditions are met and patients have realistic expectations and are mentally stable, they do not suffer from any treatable or curable mental disease that would impair their decision making. Insurance company again invest majority will cover the operation as so-called medical necessity.
Okay, thanks for your call, Ed. If you have a question about weight loss surgery, you can call us toll-free at 1-800-685-8444. That's 1-800-685-8444. Dr. Gorecki, your surgical center is one of the regional centers of excellence in bariatric surgery. What should someone look for when searching for a surgeon to perform weight loss surgery?
That's a good question. We recognize more and more that actually results can vary significantly from center to center, from hospital to hospital, from surgeon to surgeon. And what really makes a difference is to have a good system in place with good available resources, with a multidisciplinary team, including intensivist, specialized anesthesiologist, nutritionist, support group system, and very important trained surgeon. Now, how do the surgeons get adequate training? Well, at this point, these operations are very technically advanced and complex surgeries. And the training for majority of the surgeons really involves formal training in advanced laparoscopy or bariatric surgery, with getting additional information and knowledge on the problem of obesity through a variety of symposia and training sessions, and membership in American Society of Bariatric Surgery. Actually, our society, the American Society of Bariatric Surgery, came up a few years ago with a concept of selecting the best centers and naming them Center of Excellence, trying to figure whether this will make a difference, whether the best centers will do better than those who do not meet that criteria. And certainly, we're able to show it very clearly that if you combine the well-trained surgeon with a good resources and multidisciplinary approach to that complex disease, that the results are much better, and the operations can be done significantly safer. So that would be one of the ways to looking into selecting your hospital and your surgeon. These data is publicly available. You can go on the websites. You can look up the Bariatric Surgery Center of Excellence. I'm sure you're going to have a list, and you can pick up based on your preference and geographic location to go for the initial consultation with a particular surgical group.
If you have a question about what it takes to prepare for bariatric or weight loss surgery, what bariatric or weight loss surgery is, you can call us toll-free at 1-800-685-8444. That's 1-800-685-8444. Dr. Gorecki, there are a variety of, you're the director of the Division of Laparoscopy, or the chief. What is laparoscopic surgery, and how is that type of laparoscopic bariatric surgery different than other types of weight loss surgery?
That's a very good question. Laparoscopies actually emerged about 20 years plus ago as a really new way of doing the old GI surgery, which required open cut on abdominal wall, so-called laparotomy. And what really laparoscopy is, rather than making all this rather big and painful cut, producing increased pain and certain complications and hernias and potentially wound infections, laparoscopy will make a very small incision, about half an inch or quarter inch, and we put a very tiny telescopic instrument called laparoscope, which is connected to the camera, so we can look inside the abdomen with a magnified, very precise view. Now we use the high-definition monitors, and we can observe the operation in much more detailed, oriented, and magnified view. Now, how does it translate to improving overall outcome? Mm-hmm. Well, because by doing this, utilizing specialized small instrumentation and certain stapling devices and energy devices, and can cauterize or secure the blood vessels, we can do these operations with less blood loss, with less tissue trauma, with less cutting, less scarring, less potential for hernias or any wound complications, and that all translates to improving patients' recovery, causing them to return back to their normal lives and work much faster as compared to the traditional open operation, and also less complications, including less blood loss, less potential for blood transfusion, and overall, simply, we call it minimally invasive surgery because the degree of invasiveness on an individual's body is significantly less.
How long does the typical laparoscopic bariatric surgery take? Meaning, how long is the person actually unconscious? And then also, how long does someone generally stay in the hospital?
Well, that's a good question, and it varies between surgeons and institutions. But in general, the gastric bypass operation takes about 2 hours, and the lap band takes less than an hour. And that certainly is the surgical procedure. You have to add probably half an hour for anesthesia team to put the patient to sleep and then wake the patient up. But in general, amazingly, people are able to walk, and we encourage them to walk and be active. A few hours after the operation. Wow! And they usually leave the hospital within a day after a lap band operation, and usually 2 days after the gastric bypass, and they return to normal activity and work within a week to 3 weeks, depending on the individual needs and the type of the operation they had, and honestly, depending also on their disability situation. Mm-hmm. We know that those who are self-employed tend to go back to their activities sooner than those who have a good disability situation with their employer.
If you have a question about weight loss surgery, what it entails, what the recovery period's like, who makes a good candidate for weight loss surgery, you can call us toll-free at 1-800-685-8444. That's 1-800-685-8444. If you'd like to call for more information from Dr. Gorecki at the Bariatric Surgery Center at New York Methodist Hospital, you can call 718-780-3292. That's 718-780-3292, and they'll be able to send out more information for you. Dr. Gorecki, how much weight does a person lose after the typical bariatric surgery or weight loss surgery?
Well, that's a good question because that's really the ultimate benefit of the operation in terms of knowing some objective success. We certainly wouldn't be doing the operation if one may lose only 5 or 10 pounds. We talk about massive weight loss. We did a study analyzing more than 450 patients who underwent gastric bypass surgery, and their weight loss at 1 year is 76% of their excess weight. And that really translates to about 120 pounds.
Wow.
So we talk about massive weight loss. We talk about somebody losing about probably, again, about 75% of their obesity or their overweight or their excess weight or their excess fat, whatever one can define it, is gone. That really make the individual look completely different. It's very noticeable when they meet their friends and family after a few months. The results are impressive, and honestly, very frequently when I see my patients 6 months or a year later, it is frequently shocking to see patients being so much slimmer and happier and healthier, which is really the ultimate goal for these operations, not only to make people look better and put them in a smaller jean size, but make them healthier.
Is plastic surgery usually necessary to remove the extra skin after this type of weight loss?
Well, it is quite individual, and necessary is also a subjective term here.
Okay.
It depends who looks at this and how they view themselves and their body. But in general, people will have certain degree of loosened skin. It is just by the virtue of physics. If the fat melts, the covering skin will become a little more loose. Now, for younger individuals, those with more of a thicker, well-toned skin, this may be actually quite unnoticeable, and I frequently see the young ladies who lose 120 pounds and they do not have any extra skin. Now, if we talk about more massive weight loss, particularly for older individuals, with most of them will have a sagging skin from a start with. And certainly they're going to lose 150 or 200 pounds, that degree of extra skin will become more obvious. So we do have a plastic surgeon that comes to our support groups. He gives the presentation and he gives options and he discusses those options. But I would say for about half of the individuals who go for bariatric surgery, they at least have a thought about certain corrective operations, and probably about 10-30% of them at some point will have some sort of corrective cosmetic operation done.
The phone number, if you'd like to get more information about those support groups for Dr. Gorecki's surgical center, is 718-780-3292. That's 718-780-3292, and they can give more information about that support group. What do you eat after you've had this sort of surgery? Is there any specific needs? How does your diet change, or do you just eat less of everything?
That's a really excellent question, because this is something that patient takes. It's a proactive role and has to participate in the whole process. I tell the patient that I'll promise I'll take care of you, but you also have very significant contribution to your success. And what happens is that because you're eating much less volume of food, that smaller volume of food, we have to make sure that it's very good quality. And in general, what it means that it should be high in protein, high in vegetables and fiber and calcium and iron and vitamins. And you should really eliminate unnecessary calories, such as coming from fat sources, such as sugars, particularly straight sugars, cakes, sweets, chocolates, ice creams, etc. So you should focus on a good quality regular solid food with particular emphasis on the protein. Now, you need also take to the rest of your life certain vitamin supplements, because not only that in that smaller volume of food, it will be less vitamins and minerals that you consume, and your body needs still the same as before an operation, but also the absorption of certain products, particularly after gastric bypass operations, can be slightly diminished, particularly to iron, calcium, and certain vitamins such as vitamin B12 or folic acid. So we do recommend that to the rest of your life, one should take 2 multivitamins every day. We have a variety of preparations that can be utilized. It can be tiny pills, can be chewable products, can be liquid products. You also should take calcium, and for most of the patients, particularly younger menstruating females, iron, because they tend to get slightly iron deficient with and anemic. So this is really requirements that one should remember. It's a commitment on a patient's part, and this is truth to the rest of individual's life, not for the first year or two after they lose weight, but really with emphasis. It's a lifetime commitment and lifetime plan to take those nutritional supplements.
Okay, if you have a question about weight loss surgery, you can call us toll-free at 1-800-685-8444. That's 1-800-685-8444. Dr. Gorecki, you were talking about the need to take supplements and such after this type of surgery, especially for menstruating women. Can you become pregnant after you've had weight loss surgery?
That's an excellent question, really, because it comes down to, actually a few questions. One is a lot of morbidly obese female can be, or a significant proportion, can have problems with getting pregnant. Morbid obesity is a relative condition of decreased fertility. Mm-hmm. So we're actually getting quite a lot of ladies from fertility clinics that a variety of measures were tried to help them with their condition, and they're failed. And after they lose 120, 150 pounds, they get pregnant. So with weight loss, we can improve this fertility problem and actually helped very significant proportion of these ladies. Now, what about the pregnancy itself? Well, we recommend that one should not get pregnant within the first year after surgery for 2 reasons. One is that you just had a surgery, you're recovering, your primary goal was to lose weight, and we are not sure really what is the long-term effect on the baby and growing fetus when the mother loses a lot of weight during that time rather than what normally is gaining a few pounds every month. But the data is growing, and we have information from not only from my center but from many centers actually showing that it's certainly very safe to get pregnant after first year, and even those who sometimes unwillingly conceived before that 1 year period, frequently even a few months after the surgery, they deliver healthy and normal babies. Now, what is very important and quite exciting to learn based on several studies now, that actually babies born to mothers after they underwent weight reduction surgery tend to have less problems with their weight during their lifetime and tend to be less so-called macrosomic or having any problems very early after their birth. So that's really a key question to ask, whether weight loss surgery can benefit the children, can benefit the future generations. And it makes certain physiological sense that it may actually, because obese women have frequently condition of so-called hyperinsulinemia, where they have significantly increased insulin level in their bloodstream, which causes their baby to grow overall bigger body mass. and we know that it is very important. Your initial the in utero growth and initial year or two of your life is quite a decisive factor onto your future weight during your adulthood and your entire life. So the question is really whether doing these operations can benefit the future generation, since the mothers will be healthier and their babies potentially less prone to develop obesity.
Dr. Gorecki, how do we know that surgical procedures for weight loss provide an actual medical benefit and not just society's demands for a certain body type?
Well, initially, the obesity surgery was really, we thought that we're going to focus on improving people's weight. And by doing so, we'll improve their ability to move, their ability to function, their ability to carry on with a normal life. But as we gain more experience with these operations, we noticed that not only the quality of life improved and weight was significantly reduced, but certain medical problems, and actually almost all the medical problems that individual had, were changed or were somehow positively affected by their weight loss. Now we're building a tremendous body of evidence from the U.S. and Europe and Australia and virtually South America. Virtually the entire world can duplicate this very positive and very encouraging results of weight loss, producing resolution of medical problems, primarily those that are associated with obesity. Number one is really type 2 diabetes. It's amazing to see people who are diabetic for 5-10 years on insulin, on pills, and just a few weeks after the surgery, when they didn't even lose a huge amount of weight, they're already free of their diabetes. They do not need to take pills, they're off their insulin, and the sugars remain normal. Now, that was something that was quite amazing and better than we initially expected. So that's really a huge benefit, since the type 2 diabetes is strongly associated with obesity, and type 2 diabetes is responsible for a huge cost of the healthcare in the United States. These are billions and billions of dollars. And if we can treat the diabetes with a relatively a quick and safe operation, there'll be something that would really translate into making surgery one of the prime modality to treat the type 2 diabetes on obese individuals. Now, other medical problems such as high blood pressure, sleep apnea, asthma, we mentioned infertility, arthritis, amazingly also cancers.
They all can be helped. I'm sorry, Dr. Gorecki, it's a fascinating topic. We've run out of time. Health Talk is a production of American Growth Communications. The studio engineer is Kevin Bristow. It's produced at the Citadel Media Studios in New York City. Next week, join us for news practitioner Jody Legerfo, and she'll be discussing dermatology.